Hello, everyone. Welcome to another beautiful episode of That Is in Us. It's me here again. So, today I'm talking about something very important and interesting, talking about medical history. A lot of you notice that when you come to the hospital to see a doctor, or when you contact a healthcare provider, a doctor or a nurse to, tell them that you have a health issue that needs to be attended to, we tend to start asking a whole lot of questions. And some of you are like, why all the questions? These questions are very important. You know, any health worker that knows what they are doing will not just prescribe drugs off the hat without asking questions.
My Color TV, life in living color.
First of all, we ask for your past medical history. Before I start, I want to say, please, anytime the hospital is not a place to tell lies. The hospital is not a place to lie to your, don't ever lie to your healthcare provider. If you lie about your age on any other platform or in any other place, when you come to the hospital, please say the truth. When we ask you any questions, don't hide anything. That information you're hiding could be a very vital key, to making proper medical diagnosis. So please, anytime you come to the hospital, tell the truth. Don't lie about anything, any question that you are asked. We ask your past medical history. We want to know, what have you suffered from in the past? Do you have any long-standing health problem? Are you hypertensive? Are you asthmatic? Are you diabetic? Do you have epilepsy? Have you had seizures in the past? Have you had any surgeries? That one is also past surgical history. Have you had any surgeries, no matter how minute, lipoma surgery, appendectomy, cesarean section, any surgery, even if it's a cosmetic surgery? So far, you've gone under the knife for any reason whatsoever. Have you removed any lump before from the breast? Any surgical procedure at all? Please make sure you tell the doctors, this is what has happened. I've terminated a pregnancy before, or I've had a spontaneous abortion before, or I am hypertensive, or once upon a time in my life I had a seizure, or I convulsed. When I was little, I had asthmatic episodes. Anything at all that comes to memory, please make sure you tell the doctor. And then your present medical history will ask you, okay, presently as you came to the hospital, what is your problem? Then you can start telling. It's not when we ask you present medical history, you start telling us, in 19 my head was falling down. No. Present medical history. Do you have headache? I'm feeling feverish. 2 days ago, I found out that I started having some rashes on my skin. Anything that is happening in the present, tell us about it. Then your family medical history. My father is hypertensive. My mom is asthmatic. My dad is this. We have arthritis in the family. An uncle had cancer. Any of those things. Any family medical history that you are aware of. That's why I always hammer on it. Make sure you know your family medical history. Then you give us that. Then we ask you your age. How old are you? Please don't cut your age for the doctor. Say your age the way it is. We are not doing anything with your age. There are ailments that come up. There are illnesses that come up with age. They are age related. If you reduce your age, we start looking at it in a different light. So please tell us your real God-given age. And then we ask your position in the family. Someone that comes in and starts saying, they have sleepless nights and all that, and you find out that you are the first child, we could say, okay, maybe you have a lot of responsibilities. That is why, you're having some psychosomatic illnesses. And then allergies, very important. Are you allergic to anything, any food, any drug? I took particular drug one time and I had rashes. I ate pineapple one time, I started wheezing. I took groundnut. These are very, very important pointers, because we are going to prescribe drugs for you. We need to know if you've shown any kind of allergy to a drug, and that drug will tell us if you react to the drugs in that particular group, because drugs are in different groups and in different classifications. So our advice that before you come to the hospital to see a doctor, especially if you're coming for a long-standing health problem and it's your first time of coming to that hospital, I would advise that you take a sheet of paper and write down your history so that you don't forget anything. Okay? Write down your history. Write down things that you remember about your health, about your family, so that when you come to the hospital and the doctors or nurses start clacking you on these histories, you can easily provide them. I hope this has been very helpful to everyone watching this video. Please drop a comment, like my post, like my video, share it to people around you. Follow me on Instagram at that Sisinos, and I'll see you next time. God bless you.